These bills are really time sensitive. For example, the one in Alabama, again, that criminalizes this medical care, that has huge ramifications for the youth if it were to go into effect, right? And litigation is a long process. It is not the best tool, and it can take years. And so what treatment looks like for trans youth, for the most part, is pre-puberty. It's what we call kind of social transition, that there's no medical intervention. It's, about kind of getting to wear the clothes that they want, that they can wear their hair like they want, use the pronouns and the name that they want. So nothing medical. Once the youth hits puberty, that's when the doctors get involved. And all of this is decided with, the parents and with a physician and with mental health support. It is a long process and a very involved one. And none of these decisions are made lightly. But at that point, the youth is usually put on what's called puberty blockers. And so that prevents puberty from kind of continuing, to give the child more time to figure out what they want. It is reversible. It's used in cisgender kids that hit puberty too early. And you'll see that a lot of these bills don't ban those uses, right? So it's not that the medication is so dangerous. It's only banned for trans kids. They're still using it for cisgender kids in other situations. And then it's later, so around like kind of 14, 15, 16, that then again, in consultation with the parents, the physician, the mental health therapist, that the decision can be made to do hormone therapy. And so if you are a transgender girl, that is somebody who was assigned male at birth but identifies as female, you might start estrogen therapy and go through a more feminine puberty. So this law bans that. And so if you stop a child from their puberty blockers, that means they're going to start pretty immediately what we call endogenous puberty, the puberty of the gender that they don't identify with, that has permanent impacts on them and their ability to transition later if that's what they want. So we need to move so quickly to try to enjoin that, to stop it, because time is of the essence, right? This litigation is not going to move quickly enough to protect those kids, and that they'll suffer these really, irreversible to some degree harms. And I just wanted to also point out that this medical care is often performed on intersex infants without their consent. So to the extent that, the governments are talking about protecting the children, they all include exceptions to affirm a gender of somebody that is like intersex, or what they view as cisgender, so that these surgeries are being performed on youth in certain circumstances. And it's really just trans youth that are being banned from these. But I also wanted to highlight that, none of these decisions are made easily or quickly or without careful thought. And so these laws go against what the youth want, what their families want, and what their physicians recommend for them. And that's highly problematic.